We're delighted to have Dr. Jackson join us today so we can hear about the incredible role that Erlanger plays in ensuring everyone in our community has access to high quality health care. Welcome, Dr. Jackson.
Thanks, Steve, for the kind introduction. If I knew you were going to talk about me like that repeatedly, I would have insisted you stayed on the board. So I probably wouldn't have been as persuasive, though. But again, appreciate your remarks, Steve, and thanks for your partnership during your time on the board. Also want to thank Elaine Swafford for the invitation to speak. And I do want to thank John Jerem, who, as you mentioned, is on my board of trustees, for setting this up. Let me see if I can share screen here. I want to make sure everyone can see this piece. So is that visible to everyone, I assume? Can I get a thumbs up maybe? Are we good with my slides here in terms of seeing Erlanger? Great, thanks, Elaine. So again, appreciate the opportunity to speak. I'm actually going to just kick it right off and start with some firsthand testimonials from our patients, because they're going to be able to speak more eloquently about Erlanger than I ever could. This actually was sent to me by one of our pediatric surgeons just a couple of weeks ago. And this is from a young lady who was 17 years old and who had stage 4 esophageal cancer. Some of you may know esophageal cancer at baseline is a very uncommon disease. And it usually strikes middle-aged men, most of whom have had maybe a lifetime of bad habits. So for it to hit a 17-year-old young lady is truly a cruel twist. But this was posted on Instagram by this young lady, and I hope you'll indulge me. I just want to read it. As if all the bad has just turned into good. Wow, what a thing God did for me, placing me with all these amazing people from Children's at Erlanger. I can't begin to thank them enough. It seems that today I had my last surgery at Erlanger by my favorite surgeon, of course. Yet this was different. Throughout the 7-month journey, this was my first outpatient surgery, and probably my last procedure here at Erlanger, my second home pretty much. None of these doctors or nurses or techs or any staff mean anything to me but family. Family has always had the same meaning, but coming here, that meaning changed for me. These are my people. These are my family. I can't thank them enough for giving me my life back, letting me keep this amazing life that I love, constantly caring for me and hand and foot as if it was more than just their job, as if they really wanted to, because they do. And that's why they have this job. Erlanger, you have defeated this part of my cancer journey for me because I couldn't have done it without any of you. Now, they can't defeat the struggles I faced personally or when I'm at home, but I know they would wait on me hand and foot outside of the hospital if they could. And she goes on to thank her mother for her participation in this journey. This is another recent letter that we got from a grandmother whose grandchild actually was on our high-risk pregnancy unit. So the grandchild and her baby were in a stage of pregnancy that was fairly precarious, and she had to stay on our unit for a protracted period of time. And the team came together, took care of this mother, and by God's grace, helped her deliver a healthy boy home. Dear nurses, doctors, and staff, we want to thank all of you who worked hard and for long hours every day for the past month to save Haley's and our baby's life. Without y'all, I don't know how we would have made it to this point. Because of y'all, we have the chance to go back here together and as a whole. From our little family to y'all, thank you. We love y'all and God bless to all first and second shift. I'm not a native Tennessean personally, so I don't know if those y'alls were right, but I can certainly read them, even if I'm not hitting the accent. I hope y'all will forgive me. Many of you might have seen this. It came out earlier this year, got a lot of local press. This is from April. And we had a young lady, Mackenzie Ditto, who was canoeing down in Mentone, Alabama with her 9-year-old sister. And unfortunately, they got a little too close to a dam and a waterfall, and they were sucked into it. Mackenzie valorously was able to get her sister away, but she was sucked back in and was under the waterfall for a protracted period of time. Community members there pulled her out, started CPR on her, local EMS, because this is a team sport, shocked her, defibrillated her, and our Life Force Air Ambulance helicopters came to the scene and then brought her back here to the Baroness Hospital. She was put on a ventilator and she was put on a high intensity therapy called ECMO, which stands for extracorporeal or out of the body membrane oxygenation. So we needed here at Erlanger to be able to give her body oxygen without using her lungs. And the team did that for a full day. The next morning, Mackenzie, again, by God's grace, surprisingly, by the effort of my team, opened her eyes and had heard the nurses talking about Starbucks and wrote on a sheet of paper how she wanted to have Starbucks. So this is my nursing team with her that next morning after she'd been extubated and resuscitated. This is her the next day enjoying her caramel macchiato that my nursing team provided for her. And intriguing enough, as part of the news story, they went back to the dam, and at the same time Mackenzie was enjoying her caramel macchiato 2 days later, the kayak was still stuck in this waterfall, speaking of the nature of her recovery and what our team did over this time. And then lastly, dear staff of Erlanger Bledsoe, I would like to thank all who have been involved with my stay here in the hospital. Everyone has been so very professional, pleasant, and very accommodating. My stay has been very pleasant. This job is not an easy one, and I thank everyone for being on the front lines to take care of the medical needs of others. Again, thank you from the bottom of my heart for your loving care. And then my favorite part of this is the end. Special thanks to the people that prepared the food. It was very good. Now, as a hospital administrator, I will tell you, getting compliments around the food is fairly rare. But if any of you are ever up in Pikeville and are looking for a good place to eat, we'd be happy to accommodate you at Erlanger Bledsoe. I would also say I've heard from several people that the Baroness and Erlanger North used to accommodate people for Sunday brunch. I have to confess we don't do a lot of that today, but it does speak to the good food that we have had at Erlanger over the years. But all that said, I don't need to persist on the culinary perspective. You may say, why are you showing these elements up front? Well, it speaks to two things. One, it speaks to the dedication of the people that work at Erlanger. And secondly, it just speaks to the essential nature of what we do for Chattanooga and this region. As many of you know, we've been mission driven for over 125 years. We take care of all Chattanoogans, all people that come to us from the region are airlifted here without regard to ability to pay. And we're unique in the community for that reason. The Hospital Authority, and some of you I know were around for the time of that founding, was established in 1976. Our governance is a little unusual in that we are a hospital authority. And so the legislative delegation appoints board members, the county mayor appoints board members, and then chief of staff of my medical staff is a board member. We are the region's only level 1 trauma center, which is the highest level of trauma expertise, and we are American College of Surgeons certified. We have an outstanding trauma center. We have the region's only children's hospital and the region's only level 4 neonatal ICU. This takes care of the sickest babies who have some of the worst health conditions you can see when they're coming out of the womb. We have the region's only comprehensive stroke center, the only transplant program, and we're the only academic medical center with our partnership with the University of Tennessee. We have 1 million distinct patient counters annually, again, serving across 60 counties and 4 states. And we have over 1 billion in net patient revenue annually. We've hit that mark the past 2 years. So we're a very large enterprise. And if you look at our regional footprint, it's actually fairly vast. I think all of you know the Baroness, which you can see, one of the landmarks of Chattanooga. Been around for quite a while. Again, we're very part of our partnership with the University of Tennessee with our residents, and this is truly our flagship, and really has, again, been a servant to the community for going on many decades at this point. Our Children's Hospital, again, another flagship that we're proud of. In 2019, it was given Leapfrog Best Children's Hospital, one of the only 10 named nationally. Leapfrog, many of you may know, looks at objective metrics. It's not a subjective beauty contest. They look at performance and provide that information to purchasers, large organizations that might want to have their health plans with certain organizations like Erlanger. We're very proud of this accolade, and it speaks to the work that's done at Children's every day. Probably all of you are familiar with this building, the Children's Kennedy Outpatient Center. I want to thank all of you. I know many in Rotary were involved with both contributing and drumming up support for this wonderful facility. And really, this was a huge philanthropic lift for all of Chattanooga, and we're very proud of it. And we're very appreciative of everything that everyone in the community did to allow for us to take care of our patients in a first-class facility. Erlanger East, many of you know, got a large facelift about 4 years ago. Now has over 100 beds. And really, again, we're proud of being able to take care of the citizens out in Brainerd and Ottawa and Collegedale in a first-class way. The nice thing about East is, frankly, has been the benchmark has been our maternity services. Many of you may know the maternal hospital at Erlanger East has been ranked best of the best in Chattanooga for over a decade running. And this year, we were actually named one of the best maternal hospitals in the entire United States by Newsweek and by, again, Leapfrog Group. So East is known both regionally as well as nationally for the accolades that it provides. Erlanger Behavioral Health Hospital opened about 3 years ago. This is a joint venture that we have with Acadia. We're very proud of this facility because it's brought in required behavioral health services to Chattanooga. All of you know we have a crisis, unfortunately, with behavioral health and psychiatry in this country. And we've tried to step up to do our part to make certain that we have inpatient services. This has 88 beds. We provide geriatric services here, adolescent services in partnership with Acadia, and we're very proud of what we've been able to bring to the community through this hospital. And then if you look at our regional footprint up in the upper left, many of you may recognize that's our Squatchy Valley freestanding ED with a Life Force helicopter landing there. Since we put in that ED in Squatchy Valley about 6-7 years ago, Squatchy Valley has risen, or excuse me, I should say Squatchy County has risen from one of the lowest performing counties in the entire state on objective metrics of quality, safety, and health indicators to around a little bit over the middle of that road now. Erlanger Bledsoe is in the upper right. Again, it's a 25-bed critical access hospital. It provides services for that county. In the lower left, you have Erlanger, Western Carolina, the newest addition to our hospital group, which is in Murphy, North Carolina. And in the lower right, Erlanger North, again, which provides inpatient services and then sleep services and outpatient clinics for the citizens of Red Bank and Signal Mountain as well. But Erlanger, again, we're proud of our footprint. We're proud of our breadth and the services we provide, but Erlanger is not entirely about bricks and mortar. As Steve mentioned, I'd had a history about 10 years in the Army practicing as a critical care physician, and then moved to a high-performing healthcare system in Northern Virginia before coming here as Chief Medical Officer about 5 years ago. So I've been CEO about a year, and right when I became CEO, brought this forward to the board, and Steve and John were there at the time and essentially said there's 3 priorities that I want us to have. We've tried to put them in place here at Erlanger. The first is our people. As all of you know, having run your own industries, running your own businesses, being in leadership positions, you can't execute, you can't deliver results, you can't take care of those people that will frequent your business without taking care of your people first and foremost. Our business is quality and safety, and we need to be good at it. We need to make sure that we do operationally excellent work in everything that we deliver on. And lastly, given the nature of our position, we're a safety net county hospital authority, we have to be good financial stewards. Everything that other people in the region and the country have to do with a little bit more in terms of what they get from payers and from support, we have to make sure that we're doing it in a way that is financially responsible. And while some days are tough in that regard, we're proud of the way that we rise up for the community in this way. So when we speak to our people, we have over 6,600 associates. This makes us, if not the largest employer in Hamilton County, certainly one of the largest. And when you add the vendors that we have in our facilities, that approaches over 7,000. Our medical group is very large. We have over 400 employed physicians and advanced practice providers. The medical staff as a whole, not all of our medical staff are employed. It approaches almost 1,000 providers all in. And almost 1/3 of our workforce is nurses. I'd be remiss here if I didn't again thank Dr. Engel, Dr. Ashford, particularly for how UTC and for Chat State, how they've assisted us in terms of partnership with nursing education. Dalton State, Cleveland State, Lee University, we get great pipelines and have great partnerships with these regional educational centers, and we're very proud of our nursing workforce. And our workforce as a whole is very loyal and highly educated. As you can see, over 20% of people that work at Erlanger have been here over a decade. We've got 210 that have been here over 30 years of service. Another 37 associates have been here over 40 years. And when you look at that in the context of 2020 and how many people jump from job to job, the nature of employment nowadays, we're very proud of those people who are dedicated to our mission to Erlanger and to this region. Quality and safety, frankly, as I mentioned, are our business. My wife, unfortunately, had a detached retina 2 years ago. It threatened her vision. She had to have surgery within 24 hours of that. And I brought her to Erlanger. My youngest son, unfortunately, broke his tibia. He had anesthesia and had his leg set in our children's ED. So I eat the cooking, and I personally want it to be excellent. And I know my entire leadership team and all of our associates want that to be the case, and that's what we think about every day. Our families, our friends, this entire region. That requires uncompromising intentional execution. So we've had to raise the bar on certain standards that we do here day to day. And I'm proud of that. We've done that in a thoughtful way. We've done it in a way that respects our workforce, but we've done it in a way that says, what do we ultimately want Erlanger to be? And that is a first-class medical center that does high-end tertiary services and takes care of people regardless of how they can pay. We've put in a culture now, continuous performance improvement, innovation are necessary. This is a very competitive industry. It's a competitive market. We're competing against well-funded and very highly competent competitors. And what we need to do is make sure that we're at the top of our game. And when every patient comes in, that's an opportunity to represent that. And we have shown in my 5 years here as CMO, the team has shown improving outcomes year over year. We benchmark now with the board's direction nationally relative to how are we doing with mortality? How are we doing with case mix adjusted length of stay? How long patients are in our hospitals? We don't want them in here if they don't need to be, and most patients don't want to be in the hospital if they don't need to be. When we look at whether or not they need to be readmitted, when we look at infections in the hospital, we certainly have work to do. Every hospital should always be working toward this, but the performance at Erlanger objectively in the past few years has improved considerably, and I'm proud of the work that's been done. I'd be remiss here if I didn't speak briefly on COVID-19, and certainly in the Q&A I would expect that to be some of it. I do want to start off by saying there's been a lot of collaboration and situational awareness. Janelle Riley from Memorial, Tom Osborne from Park Ridge have been very valued partners to me over the course of the past 6 months because we're all living this together. It's unprecedented times. There's direction that comes in different ways every day from national authorities. But Tom and Janelle and I have tried to remain close around this. We have calls at least 3 times a week. And we're both part of the mayor's task force. Mayor Coppinger and Mayor Burke lead this every Tuesday with Ray Bond. And again, we've got a good community outpouring around how we make sure on a day-to-day basis we're preparing for this. Top priority, and again, I'm speaking for Erlanger here, but I think Tom and Janelle would echo this. Top priority for all of our facilities is safe care and a safe environment. We do need to be prepared and ready for a potential surge. By God's grace and some of the policies put into place and where our location is, frankly, we haven't seen a lot of what Seattle and New York and Miami and other municipalities have seen. But we, again, in the hospital setting, and certainly in the outpatient setting as well, we're vigilant. We keep our COVID-19 patients in designated areas so they get the treatment they need, and we can mitigate spread as much as possible. We're well versed on how to use personal protective equipment, and we've sourced it well. I believe Memorial and Park Ridge have done the same. We're all in the same boat around how we allocate testing, and we're all practicing as well as advocating for mass social distancing and hand washing in the community. Again, we've collaborated on visitation guidelines, which I know many of you may hear on. We want to make sure we're mitigating community spread. Family members, friends are certainly part of the care team, and we want to respect that. But on the other hand, we need to keep our workforce safe, and we want to continue to mitigate that spread. So again, I would want Rotarians and others to know the hospitals are aligned on this mission. We're taking COVID-19 seriously. We don't have a crystal ball, but it's something we're going to need to continue to follow very closely. And then for us, financial stewardship, there's no question, baseline fundamentals are challenging. We offer on the order of about $130 million of uncompensated care every year at Erlanger. And this fiscal year, which just started in July, we've actually budgeted a higher amount. So the federal and state and local dollars that we do get, we're very thankful for. But truth be told, the nature of what we have to do on a yearly basis, frankly on a daily basis, is try and improve in a way that allows for us to make sure that we can sustain our mission in a way that is sensitive to the needs of the entire community, provides tertiary care services, but also is always saying, okay, how can we make certain that the community and the region know that we need additional support to make sure we do what we're doing. I do want to, again, give reassurance. We're in a very solid position presently. I meet with the board, either the executive committee or the full board every week. We've done some good work. A lot of the things that came forward within our organization prior to COVID, so when I became CEO in September of last year, we underwent an overhaul in terms of our management action plan. Pretty much everything looking at personnel, how we do operations, how we make sure that we're paid, how we have contracting. It really was all inclusive, and a lot of what we did that time is starting to bear fruit now, and I'm very proud of that effort. But like in many of your other industries, industry losses for acute care hospitals for COVID-19 have been very high. And we are very thankful for the federal stimulus and other fundings that have come through. It's very, very helpful to us. And again, for local politicians, for those that are advocating, community leaders like those of you in Rotary, it's very helpful for us, and not just for us, for Janelle and Tom as well. We truly appreciate the funding and the support that's come through. And we're going to steward it well and put it to good use. I'd also be remiss if I didn't point out that First Horizon, Jay Dale, has been a very big advocate for Erlanger. They've been friends of us, and they were very supportive in the early days of the pandemic when we needed to make sure that we had funding going. So I'm very appreciative of, again, non-governmental agencies and entities and organizations that are willing to help us during these times. They're great community members, and we're proud to partner with them. That said, we need to look at continued strategic growth. I'm very proud, some of you might have seen, last month we started the first 24/7 STEMI program at Erlanger East. STEMI stands for ST elevation myocardial infarction. So long story short, if you have a serious heart attack, this is the first place you can get services east of Missionary Ridge. So Brainerd, Ottawa, Collegedale, up into Bradley County, North Georgia, this is the place people can go if they have a serious heart attack, and we can make sure they're taken care of in a first-rate way. We are continuing to expand our academic research. We need to make sure we're part of trials that will bring high-level academic, experimental, and sometimes fully tested therapies to Chattanooga, so we can be competitive with areas like Atlanta, like Birmingham, like Nashville. We've expanded our express urgent care centers. We're going to have another announcement forthcoming throughout the region to make sure that patients get the right care in the right spot at the right time, and we're doing this all throughout the region, and we're very proud of that. And Erlanger, again, is the site for tertiary complex innovative services. If you look at any of these areas, neurosciences with our stroke care, urology, we have the only urology residency in the region. We do robotics here. Our cardiovascular high-end services. We're the only provider of orthopedic robotics, and we will have an orthopedic oncologist who can work with our oncologists to make sure that, again, those unfortunate Chattanoogans who get long bone cancer or injuries from orthopedics that require an oncologist, we will have a provider who can take care of those within the next 2 months. That's previously something that you couldn't get in an area like Chattanooga. And our sports medicine program, we're very proud of. We have partnered with Hamilton County Schools, with Baylor, with Macaulay, with CCS, and with UTC to make sure that we're providing athletic trainers, that we're taking care of those patients. The Times Free Press did a very welcome and nice profile on that within the past couple of weeks. And this is one of the things we do that, again, provides the essential nature of services to Chattanooga. So in closing, what is it I would ask that Rotarians, those of us on the Zoom, Chattanoogans take from this message? Well, the simple fact is a healthy and sustainable Erlanger is essential for a healthy and sustainable Chattanooga. The services that we provide, frankly, are the type of services that when we're looking to bring in entrepreneurs, we want to bring in high-performing individuals to our companies. We want people to bring their families here and settle in Chattanooga and make this a more dynamic and vibrant community. They're looking at whether or not they can get the services that Erlanger provides. And I know, again, given the history, there's sometimes people that think, well, I don't need to go to Erlanger for my care. Well, if you or your loved one has a traumatic accident, if they're in a car wreck or heaven forbid they have a traumatic injury, they'll be at Erlanger. If your child or your grandchild unfortunately has a severe illness, they will be at Erlanger. And if you have a serious cardiovascular injury or you have a stroke, we're the place that provides those comprehensive services. You will be at Erlanger. And so again, I thank you for your time. I thank you for your support of this enterprise. I'm very proud and privileged to be part of the leadership team here. Very thankful for my board support. And again, thankful for all that you guys do for the community and your willingness to give us an audience today. Thank you so much. I'm happy to answer any questions.
And thank you so much, Steve. I assume you're going to pitch the questions for us if there are in the chat.
One question, Will, that came up is people can put questions in the chat if they would like to. The new COVID-19 guidelines that have just come out for quarantine, which appears to extend that. Is there, do you have any thoughts on that? I know it's fairly new.
So Steve, I assume you're talking to what came out within the past maybe 48, 72 hours?
Yes.
So the CDC released them, and then there was something from Tennessee Department of Health. Again, I would add, in addition to Janelle, Tom, the mayors, the County Department of Health has been doing great work during this time. Again, been very good partners in doing the best they can under very trying circumstances. We did see those. We talked about it on our internal leadership team. I did actually send an email to the Tennessee Hospital Association, of which we are a member. Janelle and I sit on the board there. They are fairly onerous. Without getting into the particulars, just for places like UTC, for Erlanger, for businesses in the region, they expand the restriction that people need to stay in quarantine. So I don't know how long that's going to remain in place, Steve. I think it's a fair thing for us to examine because the science is still emerging. Our workforce team, Dr. Jay Sizemore, who's over our epidemiology and infection prevention here, looked at those, and we're trying to determine the best way for us to put that into place. I will say, you know, nursing care is at a premium now, and if we apply a lot of these guidelines blanket to our workforce, it will put a lot of them who are otherwise healthy, asymptomatic, and frankly may not have been exposed to COVID in a quarantine status, and it just makes it difficult to run a business, and particularly run a hospital like what we have to do and what our other partners have to do. So I don't know if that answers your question. It is early, but I think it's something we're trying to do the best we can with the information we have.
Well, the impact on the workforce is something that UTC has thought about in the last 24 hours also. There's a question about what are you seeing with recent COVID hospitalization trends and mortality rates?
So the trends, I'm pleased to say, have gone down over the course of the past 3 weeks. And again, the mayor's task force, the hospitals, we're on dealing with this essentially every day. We've got internal calls, we've got regional calls. Again, it's tough to tell in the nature of a lot what's going on with the masking, the social distancing. Obviously, with the reopening of schools, is something that we're following closely. The Hamilton County school leadership presented to the mayor's task force this past, not 2 days ago, but 9 days ago, that Tuesday. I think they've tried to come up with a thoughtful plan that's doing the best that they can. But we have trended down over the past 3 weeks, probably hit our high water mark as a region around don't quote me on the exact, but around 140 to 150 inpatients. We're less than 100 now. I will say this job in general and in COVID in particular gives you a measure of sobriety and humility, and we're taking every day, day by day. So again, I want the community to be reassured that we've had a downtrend, but with the reopening of schools where you know, Tennesseans might look at their personal liberties and the view of masking and other things. I can't speak to that specifically, but it's something that we need to remain vigilant on. But right now, the capacity of the hospitals in the region and at Erlanger is on solid ground. Every day is a new day, though.
Thank you. Another question, how much are you seeing consumers delay or put off procedures as a result of concerns over COVID-19?
So, you know, there has been a little bit of that. Let me try and speak to that in a few ways, Steve. I appreciate that question. Many of you may know, and I won't belabor this, but there's been a fair amount of press and conversation around it. The economics of our industry require some degree of elective surgeries and procedures because that's actually where a majority of our margin and pay comes in. Now, putting aside the financials, there are a lot of people who need elective surgery who aren't just having facelifts. What they're having is surgery that they absolutely need, but might not need on an emergent basis, but they've been dealing with symptoms and signs and problems for many weeks or months, and they may lead to higher acuity conditions. So elective surgery is not just the things that you would come and do on a routine basis. Sometimes they're very serious conditions that we need to take into account. So there was a moratorium placed in Tennessee the last week of March. It was lifted the 1st of May. And so we restarted elective surgeries during that time. Our elective surgery business has rebounded considerably. It did very favorably in July and August. We've had some people that have, you know, extended concerns around, number one, visitation, wanting at least a loved one there for a portion of the time, which is legitimate, and then making sure that we're testing before they come in, that everyone has PPE, that we're keeping people who are COVID positive, that we're treating away from other areas of the hospital. We're doing that and making sure that we maintain that. And we have had some people who have said, I'm just going to wait until I see how things pan out. And certainly we respect that. Our physicians, our staff, try and accommodate them with their symptoms and signs until we can. And certainly when there is a risk to their health or well-being or life and limb, we communicate that and try and make sure that they're aware and can make an informed judgment on it. So we've seen some of that, but I think those areas in our industry and certainly regionally, and certainly for us that have reopened elective surgeries in a thoughtful, smart, and safe way, have seen those volumes rebound for the most part. The key thing that should be communicated, Stephen, again, I appreciate the question without being too long-winded, is that these things are being done thoughtfully in a way that informs the patients of the risks and benefits, and make sure that we're not sparing any any amount of dollars to make certain that our patients are safe and that they feel comfortable while they're having their procedure.
So a related question that was sent in is the patient experience today different than it was pre-COVID? You know, other than PPE or other policies like visiting hours?
Well, and that's a great question, because both of those things are significant in terms of having nurses donning and doffing, making sure that everyone's masked during times, and then not having loved ones come in and out of the hospital. And again, loved ones, just the presence of somebody has salutary healing effects. And many people, not just in Erlanger, in every hospital, have patient advocates, whether it's their spouse, their parent, their loved one, friend, who advocates for them and assists in the care, even if they're not putting in IVs. And we don't take that lightly. The visitation policies Tom and Janelle and I have discussed, our teams have discussed, have to take that very seriously. Notwithstanding that, there has been, and many of you have seen this, there has been a large push to telemedicine. I think both on the inpatient side with our ED, particularly with telepsychiatry, and a lot of our outpatient practices, a lot of patients worked with their caregivers to say, do I need to really come see you for a hands-on exam, or can we make sure we're refilling my medications? I'm telling you about my symptoms. You're letting me know where we need to go with therapy. Quite frankly, a lot of that can be done via remote technology. And very pleased that the state, the legislators agreed to extend where we were with telemedicine reimbursement. It's going to be crucial for our hospital systems to make sure they're reimbursed for services that are, that are rendered. But a lot of the things that we've heard back from patients, and we do objective surveys, the federal government makes sure that you do it, every hospital in the country does it, have shown that a lot of patients have embraced telemedicine and they like that engagement. We always are going to be here for in-person services. We need to be and we will be. But I think that's been the biggest change, Steve, is everyone moving more toward telemedicine and making sure that we're a little bit more nimble in terms of how we accommodate the patient needs. I think this will be beneficial in terms of it'll be more patient-centric. If I can have a Zoom call or a PHI protected technology and talk to my physician, getting in my car, driving in, waiting in your waiting room, being around other people who may be ill. It's not historically very patient-centric, quite honestly. And this may lend a favorable sea change that's economically supported that is going to make the healthcare system better over time.
Okay. President Elaine, do we have time for 2 more questions? Yes, okay. One question, maybe 2 parts of this is, what is the future of the facilities at Children's Hospital? I think probably referring to a new hospital. And the other part of that is this the best structure for the only children's hospital in Chattanooga to be under control of a single hospital, or should it be an entity of its own?
Yeah, fair questions. So let me tackle them in sequence. The first one, part of what we need to do, like any other hospital system, notwithstanding the fabulous philanthropy we receive from the region, which I'm very thankful for, some of what we built in the Children's Outpatient Center was funded by bonds. And so we've been working diligently in the past year to make sure our financial footing is where it needs to be. So if we were going to revamp what we need to do in any part of Erlanger, but certainly within the inpatient children's hospital, we have the financial strength to do it and to get favorable terms when we go to the bond market. And we've made good strides in that way. Again, the past fiscal year, we're still waiting on the closeout, but it is looking favorable for Erlanger, I'm very proud to say. And again, it's been the hard work of a lot of associates. Our neonatal ICU in particular takes care of a lot of babies from the region. Sometimes we have a census of 40, sometimes it's upwards of 50 or 60. Our caregivers do a great job, but the nature of the facility, frankly, is somewhat antiquated. Obviously, the entire children's hospital is antiquated as well, but between our pediatric ICU and our inpatient areas, those areas are serviceable. The neonatal ICU really needs some degree of priority. So my team and I, in conjunction with getting the financial strength where it needs to be, speaking with guidance from the board, is going to make sure we have priorities for capital that can invest in that area specifically. And what that means for a new hospital, a new tower, hundreds of beds, I'd be out of turn to speak at this point, just because I don't have all the information I need to make a calculated judgment on it. With regards to the governance, there are freestanding children's hospitals nationally. Obviously, there's one in Atlanta. Another one is very prominent in Philadelphia. There are many cities, Cincinnati, who have very prominent freestanding children's hospitals. As a general rule, they have a larger patient population base than Chattanooga does. These are just bigger municipalities, larger cities than Chattanooga. Moreover, there are economies of scale that Children's Hospital gets from being affiliated with Erlanger. We have a very dynamic leader, Charles Woods, who's a physician in that area who reports directly to me. He and I work very closely. He is a very passionate advocate for his faculty, for the physicians, for his patients, and for what children's needs. So, we're always looking at ways we can get better, and certainly that includes governance and structure. But I don't see anything imminent where we would change what the Children's Hospital is doing. And a lot of that just speaks to the size and scope of what Erlanger brings, and it's probably in the best interest of the Children's Hospital to remain a part of Erlanger.
Okay, and one last question related to nursing. Can you talk about the nursing pool in our region and the prospects to train, recruit, and retain the quantity and quality of nurses required to achieve your world-class vision?
I want us to be world-class. I don't know if that's entirely my vision, although it may be a vestige of the past, Steve, just to be fair. All that said, we're very thankful for the partnership we have with nursing schools. Again, the UTC, Lee, Dalton, Chat State, Cleveland State, others I'm probably not even mentioning. We get ones from UT. They are invaluable partners for us in terms of bringing forward new talented nurses. They're getting well trained in the region. They want to stay at Chattanooga or in Chattanooga. And I know Park Ridge and Memorial have benefited from it as well. So we're very thankful for that. All that said, it is a very dynamic and competitive market now. There is a lot of national studies that are consistent that speak to an overarching national nursing shortage, which leads to market asymmetry. Right now with COVID, there are certain municipalities, certain organizations, certain nursing agencies that are paying rates that are well above what you would pay for a market in Chattanooga. So Rachel Harris, who is our interim nursing leader, she's been with Erlanger 27 years. She started here as a bedside nurse. She knows Erlanger upside down. She is engaging with our nursing workforce to make sure that we've got a shared governance model that thinks through how we can make sure the nurses are more involved and engaged. But frankly, there's probably fewer priorities higher for my team and me than making sure our people are taken care of. And nursing, again, is the bulk of our workforce, just like it is in any acute care hospital. Again, I'm comfortable and confident that we're heading in the right direction with nursing, but every day, because the national shortage and market dynamics is something that we're vigilant about. Again, I'm very proud of our nurses. We have the best nurses, and we've got great nursing schools that support them. So again, very appreciative for that question.
Well, thank you very much. I know, having been around Erlanger quite a bit, it really is the people, the commitment and passion of everyone who works there at every level of the organization, and their desire to serve this community to the best of their ability. So thank you very much for a very informative presentation. We appreciate it.
Thank you, Steve. Appreciate everyone's time. Thank you.